Hello and welcome to our gathering for SSAs and QIDPs. This is our summary of October's gatherings. We're happy to have you. My name is Mandy Brooks. I'm a regional support facilitator in Region 3, and we share Region 2, so I'm also involved in Region 2. And Kelly, I'll have you introduce yourself.
Sure. Hi, everyone. My name is Kelly Fairmont. I am also a regional support facilitator, and I get the pleasure of working in Region 4, and as Mandy said, also Region 2.
Yeah, so great to have you here today. Kelly, thanks for being with me. And we just want to take a minute to review what we discussed during the initial gathering, which was in September. We took a high-level overview and looked at the assessment in the OhioISP, discussed core competencies. So for plan authors for SSAs and QIDPs, so that's assessment, planning, revision, and monitoring. We focused on preparation for the OhioISP, and I gave some notes as we went through, some tips and tricks as you go through the assessment. We talked about some things that would help you as an SSA or QIDP in completing that assessment with the person you're working with. So that's what we reviewed. That's how we started off in September. Kelly, did you have anything you want to add about our September gatherings?
I was just going to add that there's a link on our website. If you missed the September gatherings and you want to see a little bit about what Mandy's talking about, some of those great tips, feel free to check out September's recording and get a little more detail in case you missed it.
Yeah, thank you very much. That's very helpful. So our objectives then for October's gatherings, we want to increase the familiarity and the comfort that you guys have with OhioISP with the assessment questions. So we took a deeper dive into two of the assessment sections, communication and advocacy and engagement. And another one of our goals for October's gatherings was just to really focus on our own communication styles and how we go about facilitating communication with the team and with the person we're serving. So really wanted to focus and take some time on that. And again, we want to continue to build confidence, competence, and connections for you SSAs and QIDPs as you're working through things with individuals and with teams to really feel empowered and to know the right questions to ask or to feel confident in the questions, in the assessment questions, so that you have that conversation with people and can gather that important information.
Yeah, and Mandy, would you agree? I know at least in Region 4, I loved how SSAs and Qs were jumping in and offering tips to each other, things that worked for them, things that, just ideas that they have, things that they've tried. I love that. That's really that part about connections and finding other people who are doing the same work every single day. We've got experts all over the state, and so making sure that you all have the opportunity to share that expertise that you have, I think is really important and really helpful to all of us. So.
Absolutely. It was helpful to really take different questions throughout the assessment and hear those actually doing the work saying, you know what, I want to ask it that way. Like, of course, we don't expect you to ask every question the way it's written, but they would say, I would rephrase it in this way to say, how do you know when Joey is upset? Or how do you know when this is happening? And it really helped frame and get at what we were trying to better relay as far as facilitating conversation and answering those questions, but not just sending a list of the assessment questions to the staff and saying, hey, can you fill this out? Because that's just not realistic. It's really important that we get out and observe and assess the person while things are happening, while services are being provided, and you can gather so much information that way.
Yeah, and you get an opportunity to ask the question behind the question, right? Like when it's a conversation, you can say things like, tell me more about that, or what does that look like for Joey? How would I know I was seeing it? So I think those were some of the great things that came out of this October session as we continue to build on the previous month's gathering. So
I agree. So as I said earlier, we took a deeper dive into the first two sections of the assessment, communication and advocacy and engagement. And one of the number one questions we've received throughout the state is, hey, can we have some sample plans? And just want to note that we are hoping to have sample plans on our website by the end of the year to really give folks a look at how it can be very different from one person to another, and to see that not every question is going to be answered, but we get at that valuable information for the person. So we do have a sample here today within our PowerPoint that we can take a deeper dive and a deeper look at.
Yes, we will do that. I think just to add a little bit, Mandy, to what you were talking about, very early on when we announced about this standardized single assessment and plan for all of Ohio, one of the biggest questions that we got at that time was, how do you have a standardized assessment and plan and still have a person-centered one? And so that is part of, we are being very deliberate in the development of those examples and partnering with others to develop really good examples that show that we can still have a standardized template and have a person-centered plan, because really we all know what makes that assessment and plan person-centered are the great conversations that you have and the information that gets included there in that specific detail. So I just wanted to add that and introduce you to Rose. Rose is an example that we started using and will continue to use as we move forward in these and just continue to build on the information that we have for Rose. So I'm not going to go through and read all of this. My guess is you all are squinting and trying to read it anyway as you look at the screen. But this is the communication section, and you'll see in each section we have little subsections where questions are organized together. One of the tips that we gave in September was, anytime you see a bold question, that's really the starter question. That's really how you jump into the conversation. And then the italicized questions, the statements that follow are really to kind of deepen that conversation. It's other areas, places you might want to go within that bigger, high-level question. So you'll see that throughout this. For Rose, in the area of communication, the very first question, how does the person communicate? And I do feel like it's important to call out that communication was selected as the very first section in assessment for a reason. Communication is so important, and quite honestly, it's connected to all parts of our lives. So we really need to know, what does communication look like for each person? And putting this, how does the person communicate, as the first question was also very deliberate, because we all communicate. It just looks different for each of us. So for Rose, she uses words most of the time. We do learn that when she's frustrated, there are certain things that she does. She puts her lip out. She glares at you. She might stomp her feet. She's going to look angry. So there's some really great information that we can learn right away about how Rose communicates. That next question around, how does she let others know about what she likes or dislikes? When unhappy with something, she stops talking. She gets very quiet. We also know that people that know her well, when they see her doing that, something's going on. And so that tells us, that could mean a few different things. And we're going to get to that in just a second with a communication chart. You see a couple of other questions here. How does the person ask for help? And then how do they want or need others to communicate with them? And I love this question, Mandy. I don't know if you agree, but so often we focus solely on how that person communicates and how we want them to communicate with us, I think it's just as important that we are thinking about how does this person need us to communicate with them. So I love this question.
Absolutely. I think we can really get into that within the communication chart as well, to show how they want us to communicate with them and how they would prefer we not communicate with them as well when we get there.
Yeah, that's so critical. So yeah, I think that there are lots of pieces of information that could show up here. I think it's important to recognize that this is meant to be a conversational assessment. And so if right out of the gates, someone isn't saying, oh, this is exactly what communication looks like for Rose, you can jump around. You can move from one question to the other based on how the conversation goes. You're not expected to read the question, read all of the italicized words, move on to the next bold question. Move around within this section, however it feels most natural. So what we would expect to see now is, if you want to go ahead and show the communication chart, what you're going to see here, if you're not familiar with a communication chart, very simply, communication chart is a great way to draw attention to, regardless of whether or not you use words to communicate, there are things that we all do or say that maybe get misinterpreted. Or there are things that we do with our body language that others might think, ooh, I know exactly what that means, right? So if Mandy was in this session all frowny faced, leaning back in her chair with her arms crossed, we're going to make some assumptions about what she's telling us with her body language. Communication chart is a really great way to kind of outline when people are doing or saying certain things, what did that look like? And then that second column, what does it mean? What does it usually mean? Sometimes it's not all the time, but what does it usually mean? And then finally, what we should do or say in response to that. Or as Mandy pointed out earlier, sometimes it's what we should not do or say in response, just as important. So for Rose, getting back to her example, that we saw earlier that she gets quiet. So if you look at that second row where it says Rose goes silent, what does it mean? It means that she's upset, or it could be that she's not feeling well, and we need to give her space. Ask her what she wants us to do to help, but don't overdo it, right? Don't keep on her. What do you need? What do you need? She doesn't like that. You definitely shouldn't talk down to her or get demanding. Offer her favorite items, places, people that bring her comfort. So, Mandy, when you see this communication chart, when you see things like offer favorite items, places, people, what does that bring to mind for you? What are you thinking when you see or read that?
So when I read that for Rose, it makes me wonder, what are those items? What are those favorite places, items, or things that she seeks and finds comfort in? And so I keep that in mind, and then look for it, later in the plan, where at the end of this section, we have a summary where we list important twos and important fours. And so it may be listed there to show what is important to Rose in regards to what brings her comfort. Yeah. And it may be later in the assessment that we find that out as well.
Yeah, thank you for that. I think that's the important part to recognize about these assessment questions and these assessment conversations, is that they build. They should build on each other. And I know for me, as I'm going through, I'm thinking about things like, okay, I'm not going to forget about that. I'm going to see if I can learn a little bit more as we go. The only thing I want to call out here on this communication chart too is that last row where it says, I will cut you deep. And as soon as I see that, I'm thinking, risk, right? There might be a risk here. So reading on, it tells us what it means, that she's frustrated, that she has been known to try to cut herself. And so that, again, I'm thinking, I'm going to expect to see this show up as a potential risk, or at least I'm going to expect to see something about something a little bit more about what does that look like for Rose. So again, it should build, and we should continue to add more and more detail as we go. So if you want to move to the next one, Mandy, it gets us to that summary you were just talking about. So by the time we get here, one of the questions I know we got in one of our regional gatherings was, why are we doing the summary here? It's just a repeat of all the same stuff you just wrote in the assessment section. And I'd love to challenge that and say, actually, when you get here, it's because you've got just a little bit more work to do. You're going to look at all of that great information that you just learned in the communication section, and you're going to ask questions like, okay, what are those favorite places? Let's dig a little deeper into some of these things that we learned about Rose and figure out what is really important to her in that. I think we saw over and over again already just in this one section that having people not be bossy and that she feels in control of her own life, that's important to her. We learned that. So we're going to put that here. And important too, remember, it's all those things in someone's life, people, places, things, routines, rituals. It's those things that bring them satisfaction, make them feel happy, fulfilled. And then we've got important fours. So we definitely saw some things in Rose's communication section that were health and safety related or valued roles. So that's where we're going to, what did we learn in that communication section? We're going to kind of summarize that here into these at a high level. It's important for Rose to have others understand that when she's silent, it could mean one of two things. So you see that here. Skills and abilities. I love that this is included as part of the summary. One of the things that often historically with assessments we've done is we've focused on what people cannot do. And sometimes then we overdo it. There are skills that people have that they want to use, and we want to make sure that they are using those skills. So this is a great place to highlight what is the person's, what are the skills that they have, the gifts that they have in the area of communication. So we definitely saw some things there. And Mandy, please feel free to cut me off because I'm just rambling. If there's anything that you feel like I'm missing.
I don't think you're missing anything. I was just going to add that through conversation at the in-person gatherings, we had a lot of conversation about the summary and how you may find going through some of this information, important twos and important fours and skills and abilities in this section, you may find even more information. And so it may prompt you to go back and answer some of the other questions or add information throughout this section that you discovered by asking these in another way or looking at it through a different lens.
For sure. Yeah. So Mandy, one of the questions that we have been getting though is about repetition. So do I say the same thing in several places? So let's say I'm having this conversation here and we do learn about an important two. Do we need to then go put that important two in that assessment section too?
Well, if you want to look at it, you don't want to become repetitive. And so really looking at would it add anything to the information? Are you adding any additional information? If it's covered in this section or it's covered in the summary, there may not be a need to go back necessarily. But if you feel that you need to dig further and can gather some additional information on it, it may prompt you to go back.
Right. Yeah, I think that's important. I think people are worried about repetition. Sometimes, right? Do I have to keep saying the same things? And we want to get away from that for sure. But I do think, right, it would stand out to me if I saw a risk here, which is the next part of the summary. If I saw a risk here that I didn't see anything in that communication section, like it kind of popped out of nowhere, does that kind of feel like, yeah, we probably need to have a little more discussion and assessment about that risk?
Yeah.
Is that fair to say?
Absolutely.
Okay.
This is too where you want to take all that valuable information you discovered and be concise with it, so that it's really, you're really narrowing down what the most important things are within that section for Rose, for example. So that was the word that was being used on the day of the gathering was, so this is where we become more concise. Absolutely. We certainly don't want to increase repetition or repeat things that aren't necessary, but there are some things that you may find out that if we're reading a plan or looking at the assessment and it's like, well, where did this risk come from? We didn't see anything about that. That would certainly prompt you to go back.
Yeah. Okay. Oh, that's great. Thank you. So you can see we do have a couple of risks here identified for Rose. And in this assessment summary section, there is, we are not focused on how do we support Rose necessarily. We are focused more on, let's say what it looks like right now. Let's say what it is, because then when we get to planning, we're going to figure out how do we support Rose? How do we support her with risk? How do we support her to have those things that are really important to her present in her life? That's where we get to the action part. So I know it's tempting to think about services and supports at this point, but we're not quite there yet. However, you will see those boxes at the bottom. And this is a really great tool for you all to use, that as you get to the end of that communication section, you can start to consider, what did I hear? Does this person need any support in this area? Well, we can see that Rose probably does. Again, we're not going to decide what services or whatever. We're not going to get to solutions yet, but we can see that probably paid support is going to be needed. We also saw a potential outcome in that section. You can see that those two boxes are checked. I mean, Mandy, what do you think? Like, is this a great place to get creative too and think, is there technology potentially that we could be using here?
Absolutely. I love this section that it prompts for potential technology or even looking at a community resource that may benefit Rose or the person you're serving. It's definitely has some prompts in it that will assist you to think outside of the box.
Yeah, for sure. So what you do here is you just check that box and you're going to come back to that. You're going to come back to that. We would love to think that this conversation you've just had with Rose, with the people who know her best, have been in informal conversations, you know, wherever Rose is most comfortable, not the big team meeting thing, right? But when you do get the chance to talk as a team, this is a great conversation to be having about what will these supports look like when you're ready for planning. But again, we're not quite there yet. So last thing to call out, don't want to forget this. There's also an opportunity at the end of every summary section to say, hey, we've got some specialized tools that are either they've already been completed and we've got them right here, or they need to be completed. And this is the place where we've prompted you in each section with some examples that we know are common, but you can also add one that we haven't called out here. So speech eval, sure, go ahead and check that box if one exists. Or you can call out one that maybe we haven't addressed here in communication. So we just want everyone to recognize that there are other tools that can be pulled into these sections in this way. So.
And just as you said, Kelly, the summary plays a big part in connecting that bridge from assessment to planning, right? So it, if you look at the plan within the Word document, you actually see the first two sections, the first couple sections of the plan itself is focused on the important twos, the important fours that come from these summary sections. Is that right?
That is. You're going to actually, I love looking at it this way. We've got important 2 and 4, we've got skills and abilities, and we've got part of known and likely risks. Those are the first sections of the plan already done before you've even gotten to planning, right? Like, that's a good feeling. So it definitely gives you a jump start. Yeah, I think that's a great call out. And we're going to talk more about the bridge as we continue to get together, the thing that we call the bridge from assessment to planning. So why don't we go ahead and jump into the next one? And maybe we won't go as far in depth this time as we did in communication. There were lots of things we wanted to call out about how you can use the assessment section to build the summary, which drives planning. But when we look at our second assessment section, advocacy and engagement, you'll see we've got valued roles and making choices as our subsection. For Rose, this first question about the person's strengths, I don't know about you, Mandy, but sometimes it's really hard to brag on yourself. Resume writing is sometimes challenging for me. Like,
I struggled with this. I had a friend who she had an easier time answering my strengths for me than I did myself.
Right.
So, yeah.
Yes. So I think that for all of us, it's important to recognize that sometimes we need to make sure that we are getting to the right people. That the person says, yeah, you can definitely talk to that person, and that person might be able to give you some really great information here. So we can see what some of Rose's strengths are, speaks up for herself. I think we already saw that. That doesn't surprise me. I think we already learned that. And that also she's a great advocate for friends when she thinks someone has done them wrong. So I love the detail here because it's starting to give me a picture of Rose, who she is, right? Her personality. So that's what we would expect. What has the person accomplished that they're proud of? So Rose has said that she's proud that she earns a paycheck, and she's proud of her church membership and the volunteering that she does. And I'm, again, kind of like we talked about earlier, Mandy, I'm thinking, ooh, I'd like to know more about that. I'd like to know more about earning a paycheck. So I'm hoping that we're going to see some more as we continue to learn more about Rose's story. So this next question, just noting that it's a yes or no question. So we have several questions throughout the assessment that if you say yes, you get one question. If you say no, you get a different question. So right now in this Word document, we're just calling out both of the questions so that you can see them both, but certainly it'll look different when the questions kind of automate. So is the person able to make their own decisions? We've got some information here. We're going to keep moving though. This is just a continuation of that same subsection. If the person needs help to make a decision, how would they get it? Who would they ask? And oh, look, Mandy, there are some people identified that probably are the folks we were thinking about back in communication, yeah?
Yep. I was just going to point that out, that we now know those important people to her.
Yeah, for sure. All right. So this digs in a little bit deeper to decision making. It sounds like Rose has a close group of supports that she depends on to help her with decisions if she wants help. And then we can just keep moving. Responsibility and leadership is our next subsection of advocacy and engagement. And so we've got this first question: does the person understand making decisions that may result in a negative or legal consequence? That's a big question. So Mandy, I know that you are a former SSA.
Mm-hmm.
That's got to be a tough question, yeah?
Yeah, it is. And it's not necessarily a question you would ask the person, right? Like, do you understand making decisions that may result in a negative or legal consequence? You when it applies to some people, it doesn't apply to others. But gathering through their historical information, conversation with people, you can tell whether they do or don't. So I know someone pointed out in our in-person meeting, in our in-person gathering, where else do we ask this question? Who else outside of the field would we ask this type of question of? And it was a very good conversation, because we don't ask our friends, do you understand that making decisions may result in a legal consequence? We don't, but we know that they may make decisions that do result in negative consequences or illegal consequences. So we make note of that.
So we've got another summary right here. Advocacy and engagement. We've got important to, important for, skills and abilities, known and likely risks. Once again, we've got that kind of summary of what kinds of support might we want to be thinking about when we're ready to move into planning, and then those specialized tools. So we talked at length, I think, about the summary section for the last section. Do you think we're good to keep moving, or is there anything that you feel like we should call out before we move on from this one?
No, I think we're good. One of the questions I have received is, what happens if we indicate that there's a potential for an outcome in an assessment section, but then the team decides or the person decides they don't want that as an outcome when it comes to planning? And that's fine. This is just a prompt to say, hey, we discussed this during assessment, that maybe there's a potential here for an outcome. But if once you get to planning and you discover that that's just not a priority area for the person, or they don't want to pursue an outcome in that area at that time, that's okay. That's okay. Mm-hmm. And you can have that conversation to show why that decision was made. One of the conversations that we had a lot during the gathering was about facilitating conversation and what a good conversation looks like. You know, we took some time to compare it to a team meeting where you have 10 people around a table, and how just having that one-on-one conversation with a person, or maybe, you know, a small group, how that's so different to what we experienced during a team meeting. So I don't know if you wanted to share some of the things that your attendees shared about good qualities about a good conversation while you were there, and then we can kind of compare that to a team meeting in which we may not get that great interaction.
Yeah. You know, we talked quite a bit about body language, which we touched on earlier. And I loved that our group kind of got to the point where recognizing that you might assume something about body language. Right. That means someone's engaged or not engaged. Like, one of the examples we were talking about was because someone was saying, don't be distracted by your technology, right? You can't facilitate a good conversation when you've got technology getting in the way. And I'll admit I pushed back a little bit and said, I think we have to think about our age group also. Mm-hmm. Like, my 19-year-old daughter thinks it's totally acceptable. She wouldn't think twice if I was on my phone while we were talking. I'm not saying that we want people to do that, but I think it's important to recognize that it does look different. So, but that was one of the things. Body language. I think eye contact, folks talk about that a lot. But they also talked about facilitating a good conversation means that you don't come with your own agenda and try to control the topic and the pace, and like, I've got boxes to check, so I got to get all this done. Because, and I guess go ahead.
You go where the conversation leads you. You allow it to really go. Yeah.
You do. And I guess I'm kind of naturally speaking to how it's a little bit different than maybe a meeting, but I think it was important for us to kind of talk about what we don't do when we're just having a chat with our friends. Right? I don't come with an agenda to hang out with my friends.
Right.
I don't plan what we're going to talk about. Right. And I think the other part of that was just like being able to making sure that it's clear that you are actually listening to understand, and not just sitting there waiting to respond.
Yeah, that was the biggest thing that came out of our sessions was active listening, and not just thinking about how you're going to respond to it, but really listening and allowing to take it in to understand what they're trying to say, and clarifying what you heard, because you want to make sure you understood.
Yeah, for sure. I love that you brought that point up, because I think that is something that is an important part of conversation, is saying it back.
Yeah.
Because it does two things. It does, one, makes that person feel good about, you heard me, you heard what I said, and you care enough to make sure that you heard, that you understood. And so I love that you brought that up. So great call out. What did you hear? Or what did you hear that was like people were saying, yeah, this would never happen at a meeting, or this is how it's different?
Yeah, so we focused a lot on environment as well. So when you're at a meeting, it's usually at an office place. You are surrounded by people who may not even be the people you see on a daily basis, right? Because direct support staff can't take the time to come to a meeting. They send the CEO or the program director. And they have certain information that they know, but it's really great to get that information from the source, from those people that know the person the best. And so we talked a lot about how assessing and monitoring really coincide and go hand in hand, that we can, when we go out to monitor, we can assess at the same time, really gathering information to complete that assessment, and observing. We get much more information by just going and observing the person and having that conversation while the direct care is working, doing their daily things with the person. We can ask those questions informally and have that conversation with them, and it's amazing how much more information we learn.
Yeah. I think that when we think about inclusive kind of environments, right, or when we think about even equitable environments, I challenged the group in Region 4 to consider, when you go to get together with somebody, think about wherever it is you all are getting together, who has the power in that environment.
Mm-hmm.
And if it's anyone other than the person, you might want to challenge that setting.
I think just taking the time and building that relationship and that rapport with people, with the person that served, as well as those that support them, that's the number one most important thing that we can do as SSAs and as Qs, is just build that rapport and that relationship with the person served and those that support them.
Yeah. I think that's a great point to make. I just think that, too, recognizing that, and I'm sure many of you have heard this before, but I think it's important to continue to call out that if you've known the person for 2 weeks or 2 years or 20 years, good conversations don't happen in 1 hour meetings. It takes time. And there's no expectation that you're going to get it all that first time. It's going to build. It's kind of like that relationship that I have with my very best friend. It amazes me that I still learn new things about him, and it's been over 20 years. But it took us a long time, and we still don't know everything, and that's okay. That's not the expectation. So I'm just hoping people will be patient with themselves and not expect that you got to get it all perfect and you've got to get it all right that very first time, squeeze it all in. That's not fair to you, or quite honestly, to the person that you're supporting and their family who's saying, we're done talking to you now.
Right.
So do what makes sense, I think, is what we're trying to say. So
it takes time.
It does. It really does. Okay. Final thoughts?
I just wanted to point out, we had during a virtual session, we had a lady mention that she had concerns about completing the ISP for someone who does not use verbal language. She did the entire assessment and transferred it to the ISP, and she discovered that that was their biggest risk, was that they weren't able to communicate verbally, but that she was able to address that through the plan. And she was very pleased with the end result of that ISP once she did that full process and allowed it to see it to the end. So really some positive feedback coming out of using the OhioISP and that process for that person.
Oh, thanks for sharing that. That's
Yeah.
great.
Yeah.
I love that it sounds like she was open to, okay, we're just going to try it.
Yes.
And we're going to see what happens. We know it's a challenge. It's not easy. I mean, I don't think anyone's ever said that planning with somebody who doesn't use words is easy. It is not.
But that's why it's so important, right?
Yeah.
And that's what she said. You know, it made her realize how important that was.
Right. And I think we hope that folks will continue to share their stories, whether they are stories like Mandy just shared, or maybe it's like, man, I'm struggling with this part. We want to know those things too. So November gatherings are going to be coming up here shortly. So check those out. Check back on our website for more information, more questions that are being answered, resources. And as we always say, please do feel free to send us an email at our OhioISP at dodd.ohio.gov email address. We respond to that daily. So share your positives, your struggles. We want to hear about them. So.
Yeah, I think that's the important thing to point out, is that we're having more virtual sessions in November. So we hope more people can attend and participate in this. We want it to be an informal gathering where you bring your questions, your concerns, and it's really driven by you who are doing the work. So we want to hear from you.
All right. Well, if you made it this far, thank you so much for joining us for this summary. We have lots to say.
Yes, thank you.
Yeah, but we have lots to say because we've heard lots from all of you. So thank you all for your great participation thus far, and we look forward to more. So Mandy, until next time.
Until next time. Thanks, Kelly. Bye-bye.
Thanks. Bye.